Hello and welcome everyone to Medi Notes for Medicals. This is Ashna Viraju and we'll be discussing today about hydrostatic test from forensic medicine. So firstly we'll have the overview of it, that is we'll be dealing with the objectives of introduction, the procedures, the fallacies of hydrostatic test and when is it not required to be done. So why is this hydrostatic test important? It is one of the tests that detects if the baby or the newborn was having an infanticide or it was a stillbirth or was it a live birth, etc. in forensic medicine aspects. So this hydrostatic test is also known as the Raygate's test, and it is dependent or it is based on the fact that on breathing what happens is the lungs volume it increases, and which compensates the weight of the additional blood, due to which what happens is the specific gravity gets diminished. So before respiration a lungs would have a specific gravity of 1040 to 1050, and after the respiration it drops down to 940. So what is the procedure behind it is, firstly what we do is we take the lung sample from the lungs from the child or the baby that has lost its life, and we do a ligature over the bronchi and the lungs are separated. And then what we do is we place this lungs individually in water. So if the lung starts floating, we take the lungs and we cut it into 12 to 20 pieces and again place it in the water. Now what happens is this we can use a liver or small pieces of liver as control, and if the value or if there is no value in the test, then the liver floats, and in the pieces which it floats we squeeze them in between our thumb and the index finger under the surface of the water to see if any bubbles escape, that is air bubbles escape. But if they still persist to float even after they are taken out of the water, we wrap it in a piece of cloth and we squeeze it by putting a weight over it. Why? Because we have to remove any sort of tidal air. Now this results in three differential results. The first one is it continues to float. So if it continues to float, it might be due to the presence of the residual air. This indicates what? That the respiration has been taken place. And if the pieces sink, that means no respiration has been taken place yet. And if some pieces float, then we'll have a feeble respiration has been taken place over there. So and then what happens is a piece of lung is rolled gently between the finger and the thumb, very near to the ear. When we keep it near to the ear, we get a crackling crepitant noise which indicates a significance of the respiratory activity in it. Now what are the fallacies of the hydrostatic test? Fallacies means what might be the wrong things that can be indicated by hydrostatic test. Number one is sometimes this expanded lungs might sink because of diseases like acute edema, pneumonia, congenital syphilis, etc. And sometimes because of atelectasis. What is this atelectasis? When it happens that no air enters the lungs due to feeble respiration, but the aeration of the lungs would have occurred because of the mucosa of the trachea and the bronchi. Because of this, what happens is the complete absorption of the air from the lung by the blood, if the circulation is continued after the stoppage of the respiration occurs. And then what happens is because of this, what happens is more air it gets expelled from the lungs during expiration, and then what it is inhaled during the inspiration. So what happens over here is the respiratory movements turns to be very feeble. This leads in an obstruction, this is caused by an obstruction in the alveolar duct membrane. Now other things like this is expanded lungs cause. Now other one is it can cause unexpanded lungs. One is because putrefactive gases. So we in this sort of cases what happens is the lungs would be very soft and greenish, and bubbles of gas may be seen on the surface of the lungs which are large but and not uniform, but it considerably projects from the surface. So what happens is the gas in them it's easily pushed from one place to the another, and the identification is on pricking this bubble it collapses, and signs of decomposition in the body can be seen. in such cases. Next is artificial inflation. In artificial inflation, the fetal lungs may be artificially inflated by blowing an air through a tube or by mouth to mouth method in a process of by the pediatrician itself in a process of resuscitation of the baby and trying to bring back the baby. It's a form of CPR method, like airway system method to resuscitate the baby back to life. In such cases, what happens is the lungs can be inflated only partially, and the stomach contains air but not the intestines. The intestines won't be containing any air, and they show mottled appearance or marbled appearance. And on section, what happens is little blood is seen, but no froth would be seen over there. And then we have the external cardiac massage and administration of the oxygen. What happens is it completely it negotiates the value. Now, when it isn't needed, when we shouldn't be performing the hydrostatic test. If a fetus is a monster, and if a fetus is macerated or mummified, if a fetus is born before 180 days of gestation, that means before the viable period, and if the baby's stomach contains milk, that means the baby was alive previously, and if an umbilical cord is separated and the scar is formed. So that was the video. I hope you like this video. If you like this video, don't forget to like, share and subscribe to the channel. Also, there's an important notification. We have introduced a Telegram channel. If you require for notes, you can text over there, or you can demand for the notes over there, and we'll be sending you the notes in that Telegram channel. Also, if you have any sort of doubts, we have dropped in the Instagram profile of mine. I'll be available for any sort of DMs regarding study topic. We'll be coming with more videos. Till then, stay tuned. Happy learning. This is Ashna Vyaju signing off for today. Bye.